Okay, so welcome students, and today the session will be the Must Know Anatomy MCQs targeting for the INI-CET exam. So this is the part 2. So we are going with the part 2. Okay, this is the second part, and in the study session I have already covered. So this is part second of the INI-CET MCQs. So let's discuss once more the series. So I will continue the series for few days before the examination is conducted for the INI-CET. So let's start with the session. Before that, I would like to give you a general information about the platform of Unacademy, the benefits of joining the Unacademy, and then we can start with the session. Myself, Dr. Monalisa, and I have got a total of 8 years of experience of teaching the students for various competitive exam targeting the medical entrance examination, post MBBS, and for their specialized examination. And I have done my MD Anatomy from Armed Force Medical College, Pune. This is my unlock code ANAT10, which can be used by you for seeing the free sessions on the Unacademy platform and also for taking the subscription of Unacademy. So you can use this code for availing the opportunity of being the part of free sessions, or if you want to take the subscription. So this is the session which I have taken today. Those who have missed out the session of special sessions and special classes can join. So I have taken 2 sessions today on the special class of Unacademy, which is absolutely free. You can join this. If you are new to the platform, just use the code ANAT10 for unlocking the free sessions on the Unacademy platform. My dear friends, certain information which I want to give. If you take 3 months of subscription, you get additional 1 month of subscription absolutely free, and after that additional 10% of discount by using the code ANAT10. Same here, use 12 months of subscription and get 2 months of subscription absolutely free. Again, here also you can use ANAT10 as the code for additional 10% discount. So limited time offer for the iconic subscription where the merging of Prep Ladder and the Unacademy has been done. What does this mean? This means you can be the part of live free sessions. Along with it, you can be the part of the recorded version of the Prep Ladder. So you can be the part of all the MCQs you can solve, and you can have a conversation with the top educators of Unacademy platform live. That is the benefit added to it. So what to be done? Download the Unacademy app, go for your goal as NEET PG, and thereafter use the code ANAT10, and for that you get 10% discount. And what I suggest for the students who are in first and second year, just go for 4-year subscription. That means from the first year itself you have to start the preparation. Why the preparation should be started at this time? Because we know that all of you have to attempt for the next examination. So the preparation should be started from the day you have entered in the medical college. So all this details of the pricing has been given. 60,000 for plus subscription of Unacademy. If you want to take the subscription of both the plus and iconic subscription, it will be 75,000. So this is the detail of all the months and years subscription, whether you are going for iconic or plus subscription. Again, after this additional 10% discount by using the code ANAT10. So what are the benefits of joining the plus subscription or taking the subscription of Unacademy? My dear friends, you can be the part of live session, weekly tests, structured courses, and unlimited access. What is this unlimited access? The unlimited access is that if you have missed out any of the sessions because of your academic role or because of your internship going on, your hospital duties, your ward duties, your OPDs going on, or any emergency in your family or your personal emergency, then in that case, if you have missed out any of the live session, number of times you can see the session. So number of times, it's not just a matter of 1 or 2 times, number of times you can access the session. My dear friends, one of the new thing added on the Unacademy platform, raise your hand. So you have to raise your hand, have a conversation with the top educators live, and your all doubts will be cleared. So my dear friends, this is the MedMind scholarship test. I would like to give you the information about this chance. So the topic is pathology slides. So do revise pathological slides. And if you won the rank, if you get first rank, 100% scholarship is free for 1 year. Then if you are ranking till 4, 75%, and the other till 19, the scholarship subscription is given. So please do part in this. Okay. Yeah, good evening dear Reddy. Yeah, good evening. This is the referral code. These are the batches which is coming up. So exactly from today, integrated clinical batches, all the faculties who are taking the sessions, NEET PG batch NEET PG session batch, target next 2022 batch, and focus FMG batch. Okay, so and also I want to tell not only this, so any of this subscription you want to take, you can use this code ANAT10 for 10% discount, and professional first year, second year, third year. So first prop, second year, third year, fourth prop examination, if you want to pass out with flying colors and good numbers, and you want to score good marks, you can take the subscription for that also. All types of sessions are going on simultaneously on the platform of Unacademy. So what I want to do now, I want to start with the session now. So all the best to everyone. Let's start with the first MCQ for today's session. So question number first, this is a clinical MCQ. So I would like to read it for you. So let me just read it for you. So is it okay? Yeah. Okay. So let me read it, the MCQ for you. A 22-year-old man is brought into the emergency department following a brawl in the tavern, and he has severe pain radiating across his back and down his left upper limb. He supports his left upper limb with the right hand, holding it very close to the body. Any attempt done to move the left upper limb greatly increases the pain. A radiograph is ordered and reveals that unusual sagittal fracture of the spine of left scapula. So left scapula is injured, and the fracture is there. Fracture is extending superiorly to the suprascapular notch. So this is the landmark which is given. So you have to tell me which is the nerve of the following nerve would be damaged. So there are 5 options: suprascapular, thoracodorsal, axillary nerve, subscapular, suprascapular, and thoracodorsal nerve. So all of you please mark the correct answer. So I am getting ready is telling it C. What about others? So please read the MCQ nicely. Please don't be in hurry, and please tell me the right answer. The hint and the highlighted point is that the patient is having a great pain. Radiograph is done and it reveals sagittal fracture of the spine of left scapula, and it is extending towards the suprascapular notch. Now you have to give me the right answer. So yes, I have got Ashok Patel telling C. We have got Karnati Reddy is telling C and A both. Okay, so let me wait for others and then I will come up with the explanation. Brawl means, so the 22-year-old man is brought to the emergency department following a brawl. Brawl means vivad. Okay, in Cadaveric, what does it mean? In Madhusala. Okay. So let's see what is the right answer. So Ashok Patel is telling C and Reddy is telling both C and A. Okay. So let me wait for others, otherwise I will come up with the explanation. Actually the correct answer for this MCQ is what I told you. Please pay attention to this landmark. What is this landmark? Suprascapular notch. So what is a severe pain radiating across the back? Ashish Jha is also telling A, radiating across the back and down towards the left upper limb, and it's pain is there, and the person is holding his left arm with the right very close to the body, and the unusual fracture is extending towards the spine, and the fracture is, so this is the key point, suprascapular notch. So my dear friends, the correct answer is A, suprascapular nerve. So yes, Ashish Jha, Reddy, you are all right. A is the correct answer, that is suprascapular nerve. Now suprascapular nerve is passing through the suprascapular notch, passing very deep to transverse scapular ligament, and that is the key point which is mentioned. So because of that keywords which is mentioned in this MCQ, the correct answer is suprascapular nerve. So let me give the details of all the correct option and also the incorrect option. So in this diagram, I want to show you the location of suprascapular nerve. So my dear friends, can you appreciate here? This is the green color I am using for highlighting this ligament. This is suprascapular notch which is having also the ligamentous attachment, this ligament, and what you can appreciate below that ligament, the nerve which is traversing is the suprascapular nerve. This was the landmark which was mentioned in this clinical MCQ, and this tells that this is the right answer. So I will go with the suprascapular nerve. Suprascapular nerve is traversing below the suprascapular transverse suprascapular ligament, and it is most likely to get fractured in the scapula. So that is the key point which is giving us the right answer. Now what about the other option? Yes, Reddy is giving a very important information. Yes, when we go for the osteology, Reddy, you are absolutely right. The nerves is below and the artery is above. Absolutely right, Reddy. Absolutely right you are. Okay, so suprascapular nerve is passing through, it passes through the suprascapular notch. And what is the location, my dear friends? It is lying deep to which structure? It is passing deep to superior transverse ligament. It is passing deep to superior transverse ligament. It is passing deep to superior transverse ligament, and this is the reason the nerve is most affected in this fracture case, which was mentioned in this MCQ. So that is giving us the right answer. I would also like to give you the detail of incorrect. Now this was the MCQ. Those who have joined late and missed out the MCQ, they can see this MCQ, that what is the right answer. The right answer here is suprascapular nerve. The right answer is suprascapular nerve. Now the other options are thoracodorsal nerve, axillary nerve, subscapular nerve, suprascapular nerve and thoracodorsal nerve. So let me give you the explanation of that. So all of you can see thoracodorsal nerve here. Can you see here? Now the thoracodorsal nerve is passing behind, thoracodorsal nerve runs behind the axillary artery. So all of you can appreciate axillary artery. This structure which you are seeing is the axillary artery, and the exact location of the nerve which I am highlighting here, this nerve is passing deep to axillary artery and it is running over. It is running over which muscle? Subscapular muscle. So if you will see the course of thoracodorsal nerve, it's a branch of the thoracodorsal nerve is a branch of posterior cord of brachial plexus, and it is passing on the deeper aspect of axillary artery and running over subscapular muscle. So yes, I would like to show you one more diagram so that your anatomy is clear, anatomical fact. So see here, thoracodorsal nerve has been shown, no doubt, very nicely. You can see thoracodorsal nerve. Let me slightly enlarge the diagram. And my dear friends, here you can also appreciate it is running over which muscle? Subscapular muscle. So the landmark which was provided in the MCQ is not corresponding to thoracodorsal nerve. So this is the reason thoracodorsal nerve is not the right answer. Got the explanation? What I want to explain you is the correct and incorrect option also. So this is the reason thoracodorsal nerve is not the correct answer. Let's move to the next one. So axillary nerve, axillary nerve. So my dear friends, I would like to enlarge again this diagram. Okay, so when I am enlarging this diagram, what I want you to show is this quadrangular space. So can you appreciate this quadrangular space? This is the quadrangular space which is lying on the back of the scapula, and through this quadrangular space two structures are traversing. One is the axillary nerve and other is posterior circumflex humeral artery. So all of you just see here, this is the axillary nerve which is shown, this is the nerve and this is the artery. So two structures are traversing through this quadrangular space. One is the axillary nerve and other is posterior circumflex humeral artery. So this is the reason that this can't be the correct answer. So axillary nerve is not the correct answer. Now subscapular nerve was also given. So let me show you another diagram. So here you can see the subscapular nerve. Subscapular nerve is again originating from posterior cord. It is getting its origin is from posterior cord and it is giving innervation to it is going more distal, and it is actually subscapular nerve is innervating the subscapularis muscle, and also lower subscapular nerve is innervating the teres major muscle, and this nerve is lying very means down. It is originating from posterior cord and it is lying distal to the fracture site. The location of this subscapular nerve is distal to fracture site. So this is the reason that subscapular nerve is also not the correct answer. Medneer, good evening dear, good evening. Yes, so is it okay? Can we move on to the next MCQ? So we have done with the first MCQ, this was the first MCQ, and we have come up with the explanation of the right and the wrong option, and we have clearly seen that suprascapular nerve is the correct answer for this MCQ. So let's move on to the second MCQ. I have just shown this MCQ once again because some students joined late. Yes, ready, you are absolutely right. So let's move on to the second MCQ. All the best to everyone. This is again a clinical MCQ. Question number second. A 48-year-old man underwent suboccipital surgery. Please read each and every option very nicely. Which surgery? What is the reason? Suboccipital surgery, where the surgeon makes a midline incision. Through which ligament, my dear friends? Through ligamentum nuchae, and 1 centimeter inferior to the external occipital protuberance. And where does it end? It ends at the level of C2 vertebra. The surgeon then places a self-retaining retractor. So, the retractor is placed to give the incision, and that means they have to retract the structures like there. So that adequate surgical field is there for, because the surgery is lasting for approximately 3 hours, and during the recovery what happens? The patient is complaining of severe occipital pain, and it is observed that the patient is suffering from post-surgical occipital neuralgia. So, please my dear friends, mark the location where the surgery is performed. Incision is given midline, where ligamentum nuchae retracted for long duration of time to complete the surgical procedure, and post-surgery the patient is complaining of occipital neuralgia. So, what you have to tell, which was the nerve which was stretched due to the retractor in the surgery, and what is the post-surgical pain reason, which of the nerve, whether it is third occipital, suboccipital, great occipital, lesser occipital, or spinal accessory nerve. So, according to you, which nerve is involved? So, your time starts now. Please mark the correct answer. So, Sam is telling it's A. Sam is telling it's A. What about others? Yeah. Yes, I got the answer from Sam. What about others? Okay, so still now Sam has only given the answer. So, don't worry, I will wait, otherwise I will come up with the explanation, don't worry. So, others are not giving the answer, maybe no idea. So, can I come with the explanation now? So, according to the Sam, the correct answer is third occipital. Third occipital according to Sam. So, my dear Sam, you are absolutely right. Sam is absolutely right, and third occipital is the right answer. The third occipital is the right answer. So, how we are going to derive the right answer is the location. My dear friends, okay, Ashish Jha is telling D, okay, lesser occipital. So, the correct answer is A, Sam. Sam has given the right answer, and it's the third occipital. Actually, when we talk about the third occipital having the root value C3, that is third cervical nerve, its branch is lying very close to the midline, and it is absolutely providing innervation near the ligamentum nuchae midline and extending towards the region of external occipital protuberance. So, the location which was mentioned in this MCQ, if you will see, the location was mentioned, incision was given midline ligamentum nuchae inferior till the level of external occipital protuberance till C2, and the surgeon is using retractor to retract the area so that the surgery is done very nicely, and a clear view is there for the surgeon to perform the surgery. Okay. So, the confusion might happen because they have used the term suboccipital surgery. So, maybe some of the students get confused, suboccipital region is involved. So, the answer can be the suboccipital nerve, but it is not the answer because the retraction is done and incision is provided in the midline. So, the answer is third occipital nerve, and I would like to show you the diagram so that your vision is more clear. So, see here students, can everybody see the area of innervation? So, this is the lateral view. One of the diagram is showing the lateral view of the skull, and this is the posterior aspect of the skull. So, you can clearly see in this category, what you can clearly see is that the nerves which is affected is the third occipital nerve. So, what you can see, the third occipital nerve is exactly piercing trapezius muscle and medially in the neck below external occipital protuberance, means the skin on the area of nuchal ligamentum area is getting innervation from third occipital nerve. So, this is important for you to know. Third occipital nerve, medial branch. If we talk about its medial branch of the third occipital nerve, which is having C3 as the root value, dorsal branch. It pierces the trapezius muscle, and after that its medial branch is giving innervation to the midline of the neck posteriorly and going till the level of external occipital protuberance along ligamentum nuchae. Means it is supplying, that means it is supplying the skin in midline over ligamentum nuchae. So that was the description which was provided in the MCQ. So this is the reason that this third occipital nerve is the correct answer. Now my dear friends, I would also like to give you an elaborate diagram and make you clear why the other options are not correct. So yes, now we are exactly knowing the reason why third occipital nerve is the correct answer. No reason we have already seen here. This is the third occipital nerve. The area which is supplied by it is in the midline. So this is the correct answer. And why not the lesser and the greater occipital nerve is the correct answer. So other option was greater occipital nerve and lesser occipital nerve. So why these are not the correct answer? So I am just highlighting this. Greater occipital nerve was also provided in the option, and the other was lesser occipital nerve. Both was provided, and these are not the correct answer. So if you will see the area which is the innervation which is given by the greater occipital nerve and the lesser occipital nerve, if you will see nicely, it is not exactly in the midline, it is slightly lateral. So the innervation by these two nerves are lateral to midline. So if these nerves innervation and cutaneous innervation is more lateral to the midline, so this is the reason it will be not affected and it will be not involved in the patient. Is it okay, everyone? So we are now able to know the correct answer, okay, and we are also knowing the two of the option we have ruled out. One was the greater occipital nerve and the other was lesser occipital nerve. Okay, so two of the options we are able to rule out, the greater and that of the lesser occipital nerve, very nicely. So let's move on to the next one. What were the other options? Okay, so yes, okay, yeah. So one of the option was accessory nerve. So let me enlarge it slightly. Okay, accessory nerve, that is spinal accessory nerve. So why spinal accessory nerve is not the right answer? If you will see this diagram, the spinal accessory nerve is innervating two muscles. Actually, it is not giving cutaneous innervation in this area, it is innervating two muscles, sternocleidomastoid muscle and trapezius muscle. These are the two muscles which is getting innervation from the spinal accessory nerve, not the midline area over the nuchal line. So this is the reason spinal accessory nerve is not the correct answer. Now moving on to the next, that is the posterior ramus of C1. So actually posterior ramus of C1 का मतलब होता है, which nerve is this? Posterior ramus of first cervical nerve, that means it is suboccipital nerve. And suboccipital nerves, my dear friends, suboccipital nerve is an important content of which triangular space? It's an important content of this triangular space. What is this triangular space? This triangular space is suboccipital triangle bounded by obliquus capitis superior, suprolaterally bounded by rectus capitis posterior major. Where is the major, dear? Yeah. So rectus capitis posterior major. So rectus capitis posterior major bounding it supromedially, and inferiorly it is bounded by obliquus capitis inferior. So this is the inferior boundary of suboccipital triangle, and the content is vertebral artery. What are the content? The content is vertebral artery as shown, and also the posterior ramus of C1. So exactly it is in the suboccipital triangle, it is not in the exactly in the midline. So that is the reason it can't be the correct answer. So is it okay, everyone? After this description, is it clear why the answer of this MCQ is A, third occipital? Everyone, I have explained each and every options, also the correct and incorrect option. So is it clear to everyone? Is it clear to everyone? Okay, so that we can move on to the next MCQ. So let's move on to the question number 3rd. Okay. Ashok Patil, okay, very good. So let's move on to the next question. Which of the following arteries is a direct branch of gastroduodenal artery? Whether it is right gastric artery, left gastric artery, inferior pancreatic or duodenal artery, or right gastroepiploic artery. Welcome Ashish Jha, welcome, thank you so much. Okay, so question number 3rd, what is the correct answer? What is the correct answer? Which of the following arteries is the direct branch of gastroduodenal artery? Whether it is right gastric, whether it is left gastric, inferior pancreaticoduodenal or right gastroepiploic artery. So your time begins now. Please mark the correct answer. So I got Dipti. Dipti is telling D is the correct answer. What about others? Dipti is telling D as the correct answer. What about others? Med Nair is also telling D. Ashok Patil is also telling D. Sam is telling D. Harini is telling D. Which of the following artery is a direct branch of gastroduodenal artery? My dear friends, I am also telling D. So D is the correct answer. So very good. All of you are absolutely right and D is the correct answer. Right gastroepiploic artery is a direct branch of gastroduodenal artery. And gastroduodenal artery is a branch of which artery? My next question is, gastroduodenal artery is a branch of which artery? Gastroduodenal artery is a branch of which artery? Anyone? Gastroduodenal artery is a branch of which artery? Question number 3rd. Actually, I want to tell gastroduodenal artery can be a branch of common hepatic artery or it can be branch of right or left hepatic artery. So various sources has been seen, also mentioned in Gray's Anatomy. It can either be the branch of common hepatic, right gastric or left gastric artery. So please note down. Now let me show you this diagram. So what I want to show in this diagram, that the branches of the gastroduodenal artery. So can you see the red color, the green color circled area? Why I have highlighted that? This is the gastroduodenal artery. Which artery is this? This is the gastroduodenal artery. Okay, so that is gastroduodenal artery and very nicely you can see it's a branch from the common hepatic artery here in this diagram, and its direct branches are right gastro-omental artery, superior pancreaticoduodenal and supraduodenal artery. These are the branches of gastroduodenal artery. Okay, these are the branches of gastroduodenal artery. Other branches of direct branches of celiac trunk, one is the splenic artery, okay, other is the left gastric artery and the other is common hepatic artery. These are the direct branches. Also we can see the right gastric artery, as you can see here, it's a branch from this common hepatic and hepatic artery proper, which is again divided into right and the left hepatic artery, and the right hepatic artery is giving another branch, that is cystic artery. So why I have included this diagram, those who want to revise the important branches of celiac trunk and the further branches of their other important arteries, common hepatic arteries, they can just revise it. And I would like to write the gastroduodenal artery branches because the question is about gastroduodenal artery. So few points about gastroduodenal artery. So write down gastroduodenal artery. Gastroduodenal artery. Okay, gastroduodenal artery. Gastroduodenal artery supplies, basically it is supplying which part? It supplies blood to the pylorus part of the stomach, to the pylorus part of stomach, pylorus, blood to pylorus part of stomach. What does that mean? That means distal part of the stomach, okay. And also it gives blood supply to the proximal part of duodenum, proximal part of duodenum, okay. Now actually it's indirectly, if we talk about one more point, actually indirectly, so this is about directly, and when we talk about indirectly, so indirectly through its branches, that is pancreaticoduodenal artery. Actually there is two pancreaticoduodenal artery, one is anterior, another is posterior, superior pancreaticoduodenal artery. So, through its branches, that is superior pancreatico-duodenal artery, the anterior and the posterior, it is giving blood supply to the head of pancreas. It is providing blood supply to which region? It is giving blood supply also to the head of pancreas. Is it clear to everyone? And its branches. The next important point which was asked in the MCQ was the direct MCQ, that what are its branches. So, if we talk about its branches, before showing you the cadaveric images, I just want that everyone should know that its branches also. So, here let me highlight it. Okay. So, all of you please write on the branches, direct branches. So, write on branches of gastroduodenal artery. The branches of gastroduodenal artery is supraduodenal artery, superior pancreatico-duodenal artery, superior pancreatico-duodenal artery, and right gastroepiploic artery, right gastroepiploic artery. Now, my dear friends, so can anybody tell me inferior pancreatico-duodenal artery is a branch of which artery? Anyone? Inferior pancreatico-duodenal artery is a branch of which artery? Inferior pancreatico-duodenal artery. Anyone wants to give the answer? We have seen that superior pancreatico-duodenal, both anterior and posterior, both anterior and that of posterior is the branch of gastroduodenal artery. My question is, inferior pancreatico-duodenal artery is a branch of which artery? Superior mesenteric artery, Reddy and Sam are absolutely right, Reddy and Sam, absolutely right. Now, my dear friends, I would also like to show you another diagram, that is the cadaveric image, before moving on to the next MCQ. Okay, let me slightly enlarge this diagram. Yeah. So, I think this enlarged view is okay. Yeah. Okay. So, now my dear friends, I would like to show you this diagram where you can appreciate the cadaveric image and branches of the gastroduodenal artery. So, let me just highlight it. This is the gastroduodenal artery. This is the gastroduodenal artery, no doubt about this. This is the gastroduodenal artery, which is again giving two branches, superior pancreatico-duodenal artery, right gastroepiploic artery. So, you can see here gastroduodenal artery is giving two branches, one is superior pancreatico-duodenal, other is right gastroepiploic artery. And my dear friends, what you can appreciate that this artery is arising from the artery that is a direct branch of celiac trunk, CHA. What is CHA? CHA is common hepatic artery. What is CHA? CHA is common hepatic artery. The common hepatic artery will ultimately divide into left hepatic artery and that of right hepatic artery. See here, the common hepatic artery, the common hepatic artery is again dividing into right and the left. See here, this is common hepatic artery, it is dividing into right and the left hepatic artery. Okay. So, here I want to show this is the gastroduodenal artery which is dividing into which two arteries? The superior pancreatic and that of right gastroepiploic artery. Okay. Is it okay? So, again what you can appreciate that again if you will see this right hepatic artery, it is giving another branch which is written by CA. So, can anybody tell me what is this CA? What is this CA? What is this CA? Can anybody tell me what is this CA? Which artery is CA? Which is a branch from right hepatic artery. CA is a branch. So, can anybody tell me what do you mean by CA? CA is a branch arising from right hepatic artery. That means CA is what artery? CA is cystic artery. And posterior to these structures, absolutely right Sam, posterior to these structure, I will highlight it with blue color, we have got the portal vein. This is the structure lying posteriorly, this is the portal vein. Absolutely right everyone. So why I include cadaveric images? Because now the trends is that they not only include image based, but they are including so many of cadaveric images and letting you to identify the structure. So always we will go for cadaveric images so that a quick revision is done. So here actually this diagram is showing the part of right free margin of lesser omentum, where you can see the hepatic artery is there, proper hepatic artery, portal vein, and the other structure which I am highlighting with green color is also a part of bile duct is seen. So these are the parts of the lesser omentum. Okay, the hepatoduodenal component of lesser omentum parts, bile duct, BD for bile duct, the portal vein. So these are all the contents. You can see here the content are portal vein, bile duct, and this is HA, hepatic artery, that is proper hepatic artery. Okay, other branches are RGA. Okay, you can see here right gastric artery and splenic artery. So other branches which is also shown here is the splenic arteries and that of right gastric artery branches. Okay, and this is the left hepatic artery. So is it okay? Have everyone understood this diagram and everyone is clear with the branches of gastroduodenal artery, can identify the structure in the hepatoduodenal component of lesser omentum and can identify the structure of this lesser omentum part of hepatoduodenal segment and also the important branches of celiac trunk and gastroduodenal artery. So let's move on to the next MCQ. So I think this is clear to you. Can we move on to next MCQ, that is MCQ number 4. Everyone, MCQ number 4. So following the diagnosis of breast cancer, okay Ashok, thank you. Following the diagnosis of breast cancer, a 42-year-old woman underwent a total mastectomy, okay, including excision of axillary tail of spines, which is extending more superiorly from the outermost quadrant of breast. And post-operatively what happens, the patient is complaining of dysesthesia in the inner aspect. What is the location? Inner aspect of the arm, axilla. So according to you, which of the following nerves is most likely injured while performing this procedure? So your time starts now. Question number 4, please mark the correct answer. So Sam is telling C. What about others? Sam is telling C. So Reddy is also telling C. Ishu is telling B. Ashish Jha is telling C. Okay, so mixed bundle of answers are coming. Mednair is telling C. Medneer. Sri Rangraj is telling C. Okay. So let me come up with the explanation. B, okay, so Sabyasachi Chattopadhyay is telling B, Nilusha Lakmini is telling B, Harini is telling C. Okay, so yes, Ashok Patil is telling C. So yes, means I am getting C and B as the most of the answers are C and B means okay. So let me give the correct answer. The correct answer, my dear friends, Ashok Patil is also telling C. The correct answer is intercostobrachial nerve. Intercostobrachial nerve is a branch of which nerve? Can anybody tell me? Intercostobrachial nerve is a branch of which nerve and why it is the correct answer? I will come up with the explanation. So the key points which is provided is inner aspect of arm and axilla, means inner aspect of arm sensation is affected and you have to know, and the procedure performed is mastectomy, axillary tail of spines is approached. Actually intercostobrachial nerve, which is a branch from the second intercostal nerve, and this nerve which is called as intercostobrachial nerve is providing innervation on the medial aspect of arm. Yes, yes, absolutely right everyone, absolutely right. So this is the reason why cutaneous sensation on the key points which is given is the cutaneous sensation of which area, medial aspect of arm is gone. Absolutely right everyone. So let me come up with the explanation. So firstly I will write the explanation and then we will move on with the, so firstly what are the options provided? The correct option, I would like to give you the point about correct option. The correct answer is intercostobrachial nerve. Why? Because it is responsible, this nerve is responsible for innervation on medial aspect of arm. Actually, the reason is that intercostobrachial nerve is forming communication with which nerve? A prominent. When you go for dissection in the axillary region, a prominent communication is seen. The communication is between the intercostobrachial nerve forming a communication with medial cutaneous nerve of arm, and that is the reason in case of breast cancer, also in case of enlargement of the lymph node, central group of lymph node when enlarges, it compresses the intercostobrachial nerve and there is severe pain in the patient of breast cancers. Okay, so that is the reason. So this is the reason, this is the correct answer. What was the other options provided? The other option, absolutely right, ready. The other one of the option was ulnar nerve. So why ulnar nerve is wrong? Basically it's sensation. It's if we talk about its cutaneous sensation, the cutaneous sensation is for the medial aspect of hand. It is for the medial aspect of hand, this cutaneous sensation. So this is the wrong option. So what were the other options? Okay, let me see. Okay, lateral cutaneous nerve, axillary, long thoracic. Let me explain the other options also, then I will show you a diagram where you can see the further explanation. So we have ruled out 1 and 2. Let me just tell you about the other options also. So we have seen the correct option is intercostobrachial nerve and the incorrect option is the ulnar nerve. Now moving on with the other one, that is axillary nerve. So why axillary nerve is not the right answer? Axillary nerve is not the right answer because, my dear friends, axillary nerve is providing cutaneous sensation to which area? It is providing cutaneous sensation to lateral aspect of the shoulder. Cutaneous sensation to lateral aspect of the shoulder, you can say. So upper lateral aspect of arm, in other words upper lateral aspect of the arm. So this is not giving innervation to medial aspect of arm, so it is wrong. Now also the one option was lateral cutaneous branch of T4. Okay, so if we talk about lateral cutaneous branch of T4, it is again the wrong option because it supplies actually the area, dermatomal distribution of the lateral cutaneous branch of T4 is corresponding to which area? It is giving innervation to the nipple area, areola area and also medial aspect of axilla, but basically actually it is giving more of its corresponding area of dermatomal distribution is nipple, areola and goes towards the slight towards the medial aspect going towards the axilla, but major innervation in this area. So this can't be the right answer. Long thoracic nerve, yes, ready, absolutely right. Why long thoracic nerve is not the answer? Long thoracic nerve is basically if we talk about long thoracic nerve, it supplies serratus anterior muscle, it is not giving cutaneous innervation. So that is the reason long thoracic nerve, okay, is not the right answer. Long thoracic nerve is not the right answer because it is not giving innervation to any cutaneous innervation, it is not giving. It is giving innervation to SA. What is SA? Serratus anterior muscle. So that is the reason it is not the right answer. Intercostobrachial nerve is providing innervation to medial aspect of arm. So actually I have included this diagram where a quick revision of the whole of the upper limb. So this diagram is very useful. All of you please go through this diagram where a quick revision of the dermatomal distribution and cutaneous innervation of the anterior and the posterior aspect of upper limb can be revised. Okay, so let me show you the important one. Supraclavicular nerve, see the upper part, C3 and C4 is the root valley. Intercostobrachial nerve, can everybody see intercostobrachial nerve? It is supplying which area? Medial aspect of arm. Okay, the other option was, I am going with the option, you can revise the whole of it. Ulnar nerve, see here it is giving supply to the medial aspect. It is giving supply to the medial aspect of the dorsum and the palmar aspect of the hand. So yes, in this also axillary nerve, see here axillary nerve is more towards the lateral upper aspect of the arm, lateral upper aspect of the arm. So all of you can see in this diagram the cutaneous innervation of all the nerves of the upper limb, both the anterior and posterior view. So if you want to revise, please have a look, or you can just revise, pause the video and you can revise all the cutaneous innervation of upper limb, dorsal and anterior aspect. Absolutely right, Rangaraj. Now my dear friends, I just want to show you this cadaveric image, because here in this cadaveric image I want to point out that here the second intercostobrachial nerve, actually intercostobrachial nerve, let me use a bright color for it. So this one I am just highlighting this. Can everybody appreciate this? Okay, this nerve which I am highlighting it, I am making it thick so that you can understand. This is second intercostobrachial nerve. It's a branch. This is the intercostobrachial nerve forming communication with medial cutaneous nerve of arm. Can you see it is arising from the chest area, second intercostal region, and it is a branch from the T2 and it is forming communication with medial cutaneous nerve of arm. So that is the reason that intercostobrachial nerve is responsible for pain in the medial aspect of arm. So is it clear to everyone? Everyone, is it clear? Can we move on to the next MCQ, that is MCQ number? So we have done with this. This was the MCQ number 5th. Let's move on to the next MCQ, that is MCQ now. This was 4th. Let's move on to the 5th number. So we have done with this. Let's move to question number 5th. A 58-year-old male patient present himself to the emergency department with severe angina. Upon cardiac catheterization, it is found that he has a significant occlusion in the right coronary artery, okay, just distal to the right sinus of aortic valve. His collateral cardiac circulation is minimal. Assuming the patient is right coronary dominant, most of the patient has got right coronary artery as the dominant artery, because which artery is responsible for determining which artery of the heart is dominant, whether it is right hand side or the left hand side. The responsible artery is posterior interventricular artery, and in 90% cases posterior interventricular artery is a branch of right coronary artery. So here also the patient is right coronary dominant patient, having right coronary artery as the dominant one. So you have to tell me which of the following artery will have a normal blood flow. So 5 options are there, and the clinical scenario is given, and exactly it's very simple. So you can give the right answer because it's very simple to solve this MCQ. Question number 5th. Okay, see here, which of the following artery could be most likely to have normal blood flow? Sam is telling C. Read the MCQ nicely. What happened? Everyone is telling C. A 58-year-old male patient presents himself to the emergency department with severe angina. Okay, he has got occlusion of coronary artery. So his collateral circulation is minimal. So which of the following artery is most likely to have normal blood flow? So all of you are getting confused, I think. So I have given the hint once more. Now let me see who is giving the right answer. I have given the hint once more. Please read the MCQ nicely before attempting the answers. Got it? Got it? Ashok Patil, D, E. So now the students are changing their answers. Which of the following will not be involved is having normal blood flow? Yes, now you have understood my key points. Yes, dear, good one. So the key moment is that the patient is right coronary dominant, okay, and the significant occlusion is also in the right coronary artery. So which artery is normal? The correct answer is, my dear friends, what is the correct answer? Anterior interventricular artery. And why anterior interventricular artery is correct? A very direct MCQ. All of you can tell me what is the other name of anterior interventricular artery. It is also called as LAD. What is LAD? LAD artery, left anterior descending artery. What's the other name? The other name is LAD artery, left anterior descending artery, and it's the branch of which artery? It's the branch of which artery? Can anybody tell me? LAD artery is the branch of? LAD artery is the branch of left coronary artery. So LAD artery is the branch of left coronary artery. So my dear friends, it's less, it's not possible that if right coronary artery is involved, blocked with occlusion and all, so obviously the left one will be normal, and LAD artery is a most important branch from the anterior interventricular artery, or LAD artery is most important branch of left coronary artery, not the right coronary artery. So this is the right answer. Yes, now many of the students are giving the right answer, and very nice. So, that is a good point. And all other branch, that is marginal artery, atrioventricular artery, posterior interventricular SA node, all these are the branches of which coronary artery? Right one. So, that is not the right answer. We have got E as the right answer. Absolutely right, everyone. So, my dear friends, those who want to revise, just see this diagram of the important branches of the coronary artery. So, we are able to see the important branch of left coronary artery. Important branch is circumflex branch, the marginal branch, and anterior interventricular artery, which is also called as the LAD artery. LAD artery, one of the important artery to get involved by the thrombus formation, and posterior interventricular artery, the artery of D. What is artery of D? Dominance. Right marginal, coronary artery, nodal artery. Can you see all these are the branches of right coronary artery? So, these all can be blocked, but not the LAD artery. So, I think it is clear to you. Can we move on to the next MCQ, everyone? Can we move on to question number 6, everyone? Let's move on to question number 6. So, all of you, this is a clinical question along with a image. So, you have to identify this. It is a mixture of clinical and image based question. Question number 6, I will read it for you. A patient who has undergone radical mastectomy with extensive axillary dissection exhibit winging of scapula, and when she pushes against the resistance on an immobile object such as a wall, injury of which of the following nerves could result in this condition? So, A, B, C and D and E is the option which is mentioned in the diagram. So, you have to tell me which of the following option is correct. So, I got Reddy is telling C as the correct answer. Yeah. Reddy is telling C, Harini is telling C, Mednair is telling C. What about others? Lakshmi, C, Ashish Jha, C. Okay. Okay, thank you Veena. Rangaraj is telling C, okay. Okay, so let's move with the answer. So, I think the correct answer is also C, absolutely right. So, all these clinical MCQ which is targeting is okay. Yes, Chattopadhyay is also right. C, Sabyasachi. Okay. So, yes, the key points which is mentioned is radical mastectomy is done for the patient so that axillary dissection can be done, and in this process what happens? Winging of scapula. What does that mean? Winging of scapula means injury to which nerve? Injury is to long thoracic nerve. Injury is to long thoracic nerve, and we have to identify long thoracic nerve. C is the correct answer because long thoracic nerve in this diagram is C. Very nicely we can see it's the C which is the correct answer. Yes, Sam. Yes, Rangaraj. Yes, Harini. Okay. So, yes, we have got many of you have understood, very nice. So, C is the correct answer because it is a branch of the root of brachial plexus and we can identify C. Let me tell you about the other nerves. Actually, long thoracic nerve is arising from, so we have C5, C6, C7, C8 and T1. So, long thoracic nerve is arising from C5, C6 and C7 anterior rami of the 5th cervical, 6th cervical and the 7th cervical nerve, and C is long thoracic nerve. Okay. So, let me come to this explanation. I will slightly enlarge this diagram, okay, and I will write the name of individual one. So, what is C? Everyone has mentioned absolutely right, and C is long thoracic nerve, and many of you have given absolutely right answer, long thoracic nerve. This is C5, C6, C7, C8 and T1. Okay. What is B? What is B? Everyone, what is B? What is B? What is B? So, yes, I will tell you the name of all A, B, C, D and E. So, I am just asking what is B? Anyone wants to give the reply? What is B? B is supra B is suprascapular. Suprascapular, it is in upward direction. Okay, the lower one is nerve to subclavius. I will come with this, don't worry. What is D? What is D and what is E and what is A? All of you please try. What is A, what is D and what is E? Okay, absolutely right. Suprascapular is right. Now my question is, what is A? What is A? What is A? My question is, what is A? My question is, what is A? Let me highlight it. My question is, what is A? So yes, B and C is done. What is A? A is nerve to subclavius. No, 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 A is not that. Anyone else wants to give the answer? What is A? A is D is thoracodorsal nerve. Wow, absolutely right. Yes, D is thoracodorsal nerve. It is correct. A is lateral pectoral nerve. A is lateral. Absolutely right, Ashish Jai. A is lateral pectoral nerve. What is E? What is E? Lower subscapular. E is lower subscapular. E is lower subscapular nerve. E is lower subscapular nerve. Got it, everyone? Okay, got it, everyone? So we have done with the labeling of A, B, C, D and E. Let's move on to other diagram for it. So, okay, one more diagram I have included here where I want to show the important parts, because if it comes for image based MCQ, you have to know the identification here. So, what you can see here, this is the roots, this is the trunk, this is the divisions and this is the codes of brachial plexus. So, let me just, so this is C5, C6, C7, C8 and T1. So, roots of brachial plexus is formed by C5, C6, C7, C8 and T1. Its important branches is, this is long thoracic nerve. I will write in short form, LTN. What is LTN? Long thoracic nerve. What is this? DS. DS means dorsal scapular nerve. Dorsal scapular nerve. Now, what is this? This is SS. SS means suprascapular. This is a branch from UT. This is upper trunk, this is middle trunk and this is the lower trunk. And the lower one is NS. What do you mean by NS? NS means nerve to subclavius. Nerve to subclavius. Nerve to subclavius. Now, these are the divisions. So, this is P. Why I have written P? This is posterior divisions. This is the posterior division and this is A. What is A? A means anterior divisions. So, it will lead to the formation of codes of brachial plexus. Lateral cord from the anterior division of upper and middle trunk. Posterior, PP is the posterior division and it will lead to the formation of posterior cord, and anterior division of the lower trunk will lead to the formation of medial cord. Now, what is this nerve? Again, this is lateral pectoral nerve. This will be medial pectoral nerve and this is communicating between, this is the communication which is between medial and lateral pectoral nerve. Okay. Lateral cord, this will be musculocutaneous nerve. This is musculocutaneous nerve. What about this big trunk, MN? What is MN? Median nerve. Why it is median nerves? Because in this diagram you can clearly see it is formed by taking contribution from both the medial and lateral cord. You can see here it is formed by taking contribution from both medial and that of lateral cord. So, what is this nerve? This will be the median nerve. This is AN, axillary nerve branch, and posterior cord big branch, largest branch RN. That is, what do you mean by RN? That is radial nerve. The other branches of medial cord of brachial plexus, this is UN, ulnar nerve. This is UN, ulnar nerve. This is medial cutaneous nerve of arm and medial cutaneous nerve of forearm. So, I am writing in short form. Is it okay? This is US. What is US? These are the other branches of posterior cord. US means upper subscapular, this is LS means lower subscapular, and this one is TDN. What is TDN? Thoracodorsal nerve. TDN means thoracodorsal nerve. So in short, all of the branches and all of the important nerves of brachial plexus has been mentioned. So I am not going into much detail, but I have labeled all the important branches, parts of brachial plexus, so that a quick revision can be done, and any of the MCQs which is mentioning image based MCQ, a combination of image based and clinical MCQs can come up from this topic. So it is important that you have revised the identification of all important branches and parts of brachial plexus. So done everyone? Any doubt? Is it clear to you? Is it clear? Can we move on to the next MCQ? That is question number 7. Everyone? Okay. So let's move on to the next. Very easy one. Okay. This is the easy MCQ. Question number 7. Okay. Artery of ductus deferens arises from. Artery of ductus deferens arises from. So artery of ductus deferens arises from. Sri Mednayer Harini, yes, very good. Okay, everyone has understood. Yes, so artery of ductus deferens arises from which of the following, whether it is aorta, inferior epigastric, inferior vesical, pudendal and common iliac. So it's a direct MCQ. So I think most of you should give me the right answer. Artery to ductus deferens is a branch of. So Sam has given the answer as C. What about others? Sam has given the answer C. What about others? So yes, only Sam has given the right answer. What about others? Artery of ductus deferens arises from. Okay, yes, Sangma is giving C. Rangraj C. Most of you are C, and my dear friends, the C answer is absolutely right. Inferior vesical artery, yes, absolutely right. Artery to ductus deferens is the branch of inferior vesical artery. Artery to ductus deferens is a branch of inferior vesical artery. So it's a direct question. So I would just like to show you the diagram, and I think it is easy for you to understand. So my dear friends, just see this diagram. Here you can see either inferior vesicle or superior. So most probably inferior vesicle, you can see an important artery arising. What is the name which is going towards the ductus deferens or vas deferens? So artery to ductus deferens, artery to vas deferens is a branch from inferior vesical artery. Inferior vesical artery is a branch from the anterior division of internal iliac artery. It's a branch from anterior division of internal iliac artery. Okay. So I would like to show you another diagram. So quick revision, all of you, those who want to revise the branches of internal iliac artery. So my dear friends, what you can appreciate, this is the abdominal aorta dividing into common iliac artery. So this is so right and the left common iliac artery. Common iliac artery is again dividing into, this is external iliac artery and this is internal iliac artery. This is internal, I am writing just in short, internal iliac artery. So my dear friends, can you see the branches from anterior division? Obliterated umbilical artery, the first branch from the anterior division of internal iliac artery. Superior vesical artery, obturator artery, the vaginal or inferior vesical artery, it's also a branch from the anterior division of internal iliac artery. Uterine artery or artery to ductus deferens, middle rectal artery, internal pudendal and inferior gluteal. So all these which I have mentioned here, all these branches which I have mentioned, 1, 2, 3, 4, 5, 6, 7, 8, all these branches are from the internal iliac artery. I is internal iliac artery and these are A. What is A? All these are anterior division branches of internal iliac artery. From the posterior division, I am writing here P. From the posterior division, there is just three branches. One is iliolumbar artery, lateral sacral artery and superior gluteal artery. So these are the branches, these three branches are from the posterior division of internal iliac artery. So is it okay? A quick revision of internal iliac artery branches, is it clear? Quick division of internal iliac branches. So let's see the other MCQ, that is the next one. Let's move on to the next MCQ, everyone. Okay. A 43-year-old woman is admitted to the emergency department with esophageal pain and hematemesis after swallowing a fish bone. So, a 43-year-old woman is admitted to the emergency department with esophageal pain. So, she is having esophageal pain. Okay, just a minute. So, she is having esophageal pain. Yeah. So, she is having esophageal pain and hematemesis after swallowing a fish bone. Endoscopic examination reveals perforation of transabdominal portion of esophageal wall. So, according to you, which of the following artery is most likely to injure? So, you have got 5 options and please mark the correct answer. So, all of you please mark the correct answer. Five options are there. So, Mednair is telling A. What about others? Sangama is telling D. Okay. So, Chattopadhyay is telling D. Lakshmi A. So, can I explain the MCQ? The key point is that which part is involved. So, patient is suffering from esophageal pain and vomiting of blood, hematemesis after swallowing a fish bone. So, which part of the esophagus is injured is intra-abdominal portion, means lowermost part of the esophagus, arterial supply the question is asking. So, you have to give me the right answer. So, actually the correct answer is, let me see, I am getting answers as A, D, A, D, okay, mixed bundle of answers are coming. So, the correct answer is the correct answer is A. The correct answer is A. For solving this MCQ correct, you have to know the parts of the esophagus and getting the blood supply from which sources. So, I will write it for you and then I will show you a diagram. So, all of you please note down, this will be easy for your revision. So, if we talk about upper and intermediate part, upper and intermediate portion of esophagus, if we talk about upper and intermediate portion of esophagus, its blood supply is from following sources. It is getting blood supply from the following sources, that is inferior thyroid artery, bronchial artery, esophageal arteries. So, this is about upper or intermediate. Now, in the MCQ, what was involved? Lowermost part. Now, I would like to tell you the arterial supply of lower part of esophagus, lower part of esophagus. Please mark it. I am telling lower part of esophagus. Okay, now I am telling lower part of it. When I am talking about lower part of esophagus, the blood supply of lower part of esophagus is from inferior phrenic artery and that of left gastric artery. So, these are 3 sources for the upper intermediate part, 2 sources for the lower part, inferior phrenic and left gastric artery. Got it? Now, if I talk about lowermost portion, of the esophagus, that is after piercing the esophageal opening of the diaphragm, that is the lowermost portion. So, that is like, so you can say lowermost portion of esophagus. What does this mean? Lowermost portion of esophagus means after, below diaphragm, that means below diaphragm. What is the blood supply source, my dear friends? What is the blood supply source? The source is left gastric artery. The source is left gastric artery. So, this is the reason left gastric artery is the right answer, because in this MCQ, the lowermost portion of the esophagus was injured and involved. So, left gastric artery is the right answer. So, please do revise the arterial supply of all the 3 parts of esophagus, lower, lowermost and the upper and intermediate. The sources I have written. So, this will help you to approach to the right answer. So again, let's move on to the MCQ now. So I have marked as the right answer is the branch of left gastric artery. Now I will come up with the explanation why. Because branch of left gastric artery is supplying lowermost portion of esophagus. So this is the right answer. Now why not bronchial artery is the right answer? Bronchial artery is supplying small section of esophagus inferior. It is mainly supplying small portion of esophagus which is lying inferior to the T4 level. So it can't be the right answer, means uppermost part. Upper part only. Thoraco-intercostal, it do not contribute blood supply to esophagus. It is not giving blood supply to esophagus. It is basically giving blood supply to intercostal spaces. It is giving blood supply to which spaces? Intercostal spaces. So that is the reason C option is not right. What about D? D. Now my dear friend, D is also not right. Gastric artery is a branch of common hepatic artery and it is giving blood supply to the pyloric part along the lesser curvature of stomach. Lesser curvature of the stomach. So this is the reason that it is also not right answer. What about right inferior phrenic artery? Inferior phrenic artery is also not, because it will supply esophagus just the part of the, it is giving the blood supply to the part just close to the diaphragm, esophagus part just close to the diaphragm. So if we go the here intra-abdominal portion, please mark the key points which is mentioned. The key points is intra-abdominal portion of esophageal wall. Okay, intra-abdominal portion. So we will go for the right answer A. So is the explanation clear to everyone? This is the reason the answer is A. Absolutely right, Akram, absolutely right. So now I would just like to show this diagram. So here you can see esophageal branch of the esophageal branch for the inferior thyroid artery giving giving blood supply to upper part of esophagus. Also esophageal branch of bronchial arteries, esophageal branch of thoracic aorta, esophageal branch of inferior phrenic artery just at the level of the diaphragm, and esophageal branch of also left gastric artery below the level of diaphragm, that means abdominal part of the diaphragm. Here also you can see when the esophagus, you can see here this is the esophagus and here you can see this is the esophagus, and just at the level close to this opening it is getting blood supply from inferior phrenic, but when it traverses lower down in the abdomen region, left gastric artery will be the answer. So that is the reason left gastric artery will be the answer. So I think it is clear to you everyone. Is it clear? Okay, very good. Now my dear friends, before ending the session, I will come up with my session on 2nd July. So 2nd July I will again take maybe afternoon session for you for the Let's Crack NEET PG platform पे मैं आऊँगी MCQ session, that will be a clinical MCQ. You can see my sessions free, special session on the Unacademy platform by using the code ANAT10 for unlocking free sessions on the Unacademy if you are new to the platform. I also want to tell that this is the Telegram group of mine. This is Monalisa Anatomy. So those who want to join, they can join this group of mine for anatomy updates and links of my all free sessions, also the plus sessions and also my YouTube sessions. You can follow me on the Unacademy app and you can get the notification of all my live sessions. Okay, before ending the session, I would like to just give you an introduction about the code, that is ANAT10. So you can use this code and get 10% of discount and you can take the subscription. Now the 4-year subscription has the new feature added on the Unacademy platform. By this what happens, you get a discount. You have got 4-year subscription at the rate of 60,000 and 75,000 for iconic subscription. This amazing offer can be availed by the students of 1st and 2nd year. So this is the whole details of the subscription, whether you are going for iconic or plus subscription, and from 4 years till the 3 months details has been there. So you can take whichever subscription suits you, you can take the subscription and you can use my code ANAT10 for 10% discount. All the best, keep studying, thank you so much. So yes, thank you so much. We will meet on 2nd July with the session of clinical MCQs. I will share the link on Let's Crack NEET PG, also on the INI-CET NEET PG Unacademy group, also on my own group Monalisa Anatomy. All the best. Thank you so much. Thank you.